I'd like to call a meeting to order here for October 21st. This is the Sacramento Environmental Commission. Jill, would you like to read roll call, please?
Mark Berry, Richard Hunn,
Here.
Diane Kinderman,
Here.
Paulina Kolick,
Here.
Thomas Molson,
Here.
Laura Nickerson,
Here.
Eric Rivero Montez, Josh Rosa,
Here.
Mark White.
Here.
We have a quorum.
Thank you. What I'd like to do is just have a brief introduction of the commissioners here. Tell us who you're representing. Maybe you can start on your end of the podium here, Tom.
Tom Molson. I represent Folsom, Ileton, and Galt.
Laura Nickerson, Sacramento County.
Mark Berry, City of Sacramento.
Diane Kinderman, the City of Sacramento.
Richard Hunn, Sacramento County.
Marie Wooden, Director for Sacramento County Environmental Management Department.
Mark White, Sacramento County.
Josh Rosa, City of Sacramento.
Paulina Kolick, Sacramento County.
Thank you, everybody. What I'd like to do is recognize a new commissioner who's joining us tonight, Paulina Kolick. Paulina, could you just give us a few minutes of description about yourself and your background?
Yeah, of course. I have a bachelor's and a PhD in analytical chemistry. I did academic research for about a decade on different topics like air and water quality and also solar energy. And then recently, for the past 2 years, I've been a senior environmental scientist with the state.
Which department with the state?
CalRecycle.
Okay, thanks. Well, welcome aboard. We're glad to have you here. This is an opportunity now for public comment. If anybody would like to come before the commission to make a statement or ask any questions, you're welcome to. Seeing none, we'll pass on that. So I'll go on to our next agenda item is our annual health report from the County Department of Health, Dr. Cassirier. And she's here to give us a statement, which we'll always find interesting.
Good evening, Commissioners. There's a PowerPoint coming up.
Could you pull up the first presentation, please? Thank you.
And while it's coming up, thank you again for having me here. There's a lot going on, and of course I can't cover everything, but I decided to focus on just 3 things that I thought would be interesting to you. One is syndromic surveillance. The second one is an issue we're dealing with Mercury.
Could you speak up a little louder, please? We're having a hard time hearing you.
Is that clearer?
Okay, thank you.
Okay. I'll try to speak up. The second issue is mercury in contamination in face creams, and we had a serious case here in Sacramento. And the third one is, I'm sure you've all heard about the issue we've had with respiratory illness in people who are vaping. And so I wanted to give you some data on that as well. So starting off with syndromic surveillance, make sure this works. Usually in public health, we're very dependent on data that we receive, and most of the surveillance that we do is actually reports that we get from healthcare providers. So there's a list of about 20 or so communicable diseases. If one of those shows up when a doctor is seeing a patient, they have a reporting mechanism, and that comes to us, and then that triggers certain actions. We also get a lot of information from birth and death data, but usually there's a delay with that, so usually that's when we're looking at trends. But if we want to be able to get information real-time, information that we can act on, we would like to be able to get information a little quicker. So syndromic surveillance gives us that ability, and what it does is it's a system that collects information from various sources, emergency rooms, pharmacies. It can get it from poison control, and so once you get all of this information together, and the way that it comes to us in public health, it's de-identified, and so we're just using codes. For example, when a physician sees a patient in the emergency room for flu, there are certain codes we call ICD-10 codes that they will use, and that's what we pull together to be able to find out what's happening in the emergency rooms. Some years back, one of the things that we used to do, especially when we had the really bad flu seasons, is we would have someone call each of the emergency rooms every morning to say, how is it going? How many cases? Are you backed up? So this actually gives us another way, so we're not actually disturbing the emergency rooms, asking someone to speak to us and tell us what the status is. So a lot faster and gives us a lot of information. So as I mentioned, we've been using this syndromic surveillance system, and the one that we use in Sacramento is called Biosense, and we had to apply to the Centers for Disease Control to get this. We have been using it in various ways, as I mentioned, for the flu. We also used it especially earlier this year when we were doing surveillance for measles. We had a few measles cases, so of course we were looking at data to see if there were any other children with rashes and fever that could fit the criteria that were showing up. Also, just to point out that we're not only going by diagnosis, we're also looking at a syndrome. So if, for example, we're looking at influenza-like illnesses, we'll look at things like difficulty breathing and fever and that combination, and that's what will all be pulled in order to be able to look at a fuller picture of what's happening. We've also used it in other situations when we have food poisoning or meningitis. I don't expect you to read what's at the bottom, but it just gives you an idea of what are the kind of screen that our epidemiologists look at. So that the data is dumped into this system at least every 6 hours, but we can look at it at any point. So it does give us a pretty good picture. At least twice a day we get an update. This is to show you a little bit more of what we get during especially the flu season. And you can see that the dark blue is the influenza-like syndrome that we look for. And there's also what we call a subsyndrome, where you're looking for things like someone who comes in with difficulty breathing, somebody who comes in with fever. So it might not specifically fit the flu, but it does also give us a better picture as well. And then the very light blue is also ICD, the specific ICD code for influenza. So you can see that with each of them you get a little bit more information. If we were only looking for the diagnosis influenza, we would miss a lot, and so we would not be able to get a very good picture of what the flu season looks like. So during the course of the flu season, and again, I don't expect you to read this, but just to show you the kinds of reports that we look at, our epidemiologists will put out information to our healthcare community during mid-season and at the end of the season. So the fact sheet on the left shows you what we would provide to them at the end of the season, so they get to see what we analyzed, how bad the season was, what kind of activity, and what populations were being affected. And then mid-season, the one on the right also shows you a report that we give them to show them what's going on, because of course they'd like to know, are we getting to the peak? Are we getting to the end of this? So it helps them a lot to know what is going on and get the big picture. So one of the things that has happened lately, especially with the concern about climate change and the number of triple-digit days and what's happening with heat, is being able to look at how we can use syndromic surveillance for this. Because prior to our using this system, we were only dependent on information that we were getting about deaths due to heat stroke, and those are very few and far between. but we know that there are a lot more people who are impacted by heat. So by being able to go in and pull the emergency room data, where we are looking at syndromes, someone comes in with heat exhaustion, they get discharged, or dehydration and all of those kinds of things, we're able to pull them. And again, I don't expect you to read this, and if you are interested in getting these fact sheets, I can definitely send Jill a link so that you can look at them more closely. But this shows you the kinds of reports that we put out to the community, especially the medical community. And the thing about this report also is that we can look at the geographic distribution and see which areas are most impacted. So it gives a lot of information for us when we're trying to plan, and also to see what is happening over a period of time. This shows you what the epidemiologists get, and the blue bars are the ED visits, and then the red bars are where we, the red bars are the temperature. And I'm sorry, the red bars are the high, when we had an increase in the number of cases. And then you see, I'll call them squiggly lines. The top one, the dark brown one, is the high temperature for the day. And then the bottom one, the light brown one, is the low temperature for the day. And you can see that there is some correlation between when the temperature started going high and the increase in ED visits. Some other data that we can get demographic information, so we can look at which hospitals the patients are going to, we can see which areas they're going to, and we can see what the disposition is, and we can see from here that most of them are discharged. There are some deaths, but those are few and far between. And then we can also look at the age groups. One of the things that surprised us about looking at the age group is that prior to this, our message had always been that the very young and the very old are the ones that are most impacted, and our message had always been that these are the age groups that we need to make sure they are not out in the heat, and they're the ones that we needed to look out for. But this was a great surprise to see that the young, 18 to 44, were being impacted. I imagine that these are people who are healthy, who are thinking, well, I can deal with this, and they go out and suddenly, collapse with heat exhaustion or something like that. And so that actually made us rethink our message, and to make sure that we make it clear to everybody that anybody can be impacted by heat. So again, you see the value of some of this data that we're getting that is much richer than what we were getting with just looking at death data. We can also, again, map it geographically. So this shows you what the areas, of course, no surprise. Downtown is the one that had the highest numbers. So the wildfire smoke, I think you all remember very well what happened during November of last year, the Butte County fire, the Camp Fire, where it impacted, let me see, just want to make sure I give you the right information. Okay. Started November 8th and went on for about 18 days, so was contained on 25th November. And of course, Paradise, was burnt to the ground, and this is only about 2 hours away from us. And so the air quality in Sacramento and the Bay Area was very bad, unhealthy to hazardous air quality. And so, of course, questions were coming up about what should we do? Should we tell people to stay at home? Should we tell them to stay indoors? How about people who work outside? So we were kept really busy trying to get information out. Of course, there were also questions about how useful masks are, and we were fielding all of those questions. One of the things that we were dealing with in the background also was trying to find out, was our message getting out how are people being impacted by that? Were we seeing increases in the number of people showing up in the emergency rooms? So at this point, the Centers for Disease Control actually reached out to us and said, hey, do you need some help in analyzing your data? So they actually helped us with that. And this is, it looks a little busy, but just to explain again, the blue is emergency room visits, and then the brown is shows you what the air quality was, and then you have the red dots that were alerts, and the yellow dots were warnings. And so this just gives you an overview over the period of July to December, what it looks like, and you can see the peak during the November. If we hone down on that, the vertical blue bar is when the incident started. And you can see from here that we were seeing from the ED visits increases, though if you look on the left-hand axis, the numbers, even though they weren't very high, again, we still see that there was some increase, and it did correlate very closely with the air quality, especially looking at PM 2.5. And honing down even more, and also looking at not just so what the CDC did was also pull in additional data, for example, looking at things like mention of paradise, mention of evacuation, and mention of chronic diseases. And you can see that when we added that information, we were able to get more data, and it actually showed that the increase in ED visits actually was sustained for even a little beyond the very bad air days. So really important, of course, even though the numbers may have not been so high, but very important to get the message out there and make sure that people know, especially for those that have chronic diseases, the importance of them taking measures to not have to be out in the bad air quality. What did I do? Maybe I should ask if there are questions before I move on to the next one.
Yeah, I have a question. I hadn't heard of the term syndromic surveillance before, so I looked it up real quickly here, and it's regarding methods to rely on detection of individual and population health indicators
Sure.
that are discernible before confirmed diagnoses are made. So this is I guess you'd almost call it a real-time view of big data that's coming into your system, and you're able to see trends as they are actually occurring.
Absolutely, and our hope is that it can help us to detect, in addition, of course, from the information that we get from our healthcare providers, it will help us to detect if there's an outbreak going on. Actually, when we were monitoring for measles cases, we were pulling that information in, and there were sometimes cases that we pulled up that where the physician had thought about measles and then decided not to report it for one reason or another, decided that maybe it didn't quite fit the criteria, but we were able to follow up on that. So it is very helpful and does give us real-time data, and does not wait for the healthcare providers to report to us. This is information that we get just based on syndromes.
Do you use various statistical packages to analyze this information, or are you looking mostly at trends at this point?
A lot of statistics. We have one key epidemiologist who has been spending a lot of time learning this and learning how to analyze the data. And as I mentioned, during, for example, in November when we had the wildfire smoke, we did get assistance from the CDC, and they have a lot of additional expertise that they can add in helping us analyze data.
Cool. Any other questions from the Commissioner? Mark?
As usual, what a phenomenal job. Thank you very much for serving the county. We all appreciate it.
Thank you.
Couple quick questions. How is this program funded?
So to begin with, when we were setting up, because it required a lot of time working with the hospitals to get them onboarded, we were able and successful to apply for CDC funding. But now the epidemiologist who is working on this is funded by the county.
So it's a long-term deal.
It's a long-term deal.
Wonderful.
Yes.
How many is this program used statewide?
In some states, it is used statewide. In California, because we like to do things differently, and also because California is so large, I think there are only 8 counties right now that are using it, but hopefully in the future more and more counties will come on board, because the advantage, of course, is that then we'll be able to look not only on our data, but we'll be able to get information for the entire state, and we can do a lot more analyzing.
Truly an amazing tool. What's your recommendation with regard to, I see the issue with the flu that you brought up, with regard to people getting flu shots? Does the department have any recommendation about that?
We recommend that everybody get a flu shot.
Thought you might.
Yeah.
Lastly, on PM
unless you have a medical reason for not getting it.
on the PM 2.5 and the smoke from the fires, how useful were those masks that some of us were using?
I'm sorry, what was the question?
The face masks that we put on to try to keep the smoke out of our lungs.
I was hoping you would not ask that question. There was a lot of discussion going on with the face masks, because absolutely there is value to using the face masks. But what we did find from especially information that we were getting from the state is that a lot, because the public, if they're using it, they don't get the training to be able to learn how to put it on properly and how long they can keep it on. And so we were finding a lot of people who are not using it appropriately. So we would have people who would get a mask and then go for a 10-mile bike ride because they had to get their bike ride in, and that's not what you're supposed to use it for. It's supposed to be for you when you are not able to keep away, for example, people who have to go from one place to another and have to go through the bad air, to use it for just a limited period of time. The other thing too with the masks is that they do impede breathing. And so for people who are most vulnerable, who should benefit the most from it, the problem for them is that it makes it more difficult to breathe. So they could end up having an asthma attack just because they're not able to breathe with the mask on. And also there are no sizes for children. And of course, children is the other group that we are concerned about. So there's definitely still ongoing discussion about that, and we've discussed it again and again among the health officers. And some feel that we should use it, some do not. But I think the message that we need to make sure that people know is that it should only be used for a limited amount of time. You should make sure that it fits well. Use it according to the manufacturer's directions. For example, you can't extend the life of the mask by wiping off the dust, which is what some people were doing because they had only one mask. So they thought, well, if I wipe off the dust, I'll be able to use it for a longer time. Well, that just destroys its ability to, to keep out the very small particles. So very important that you use it appropriately. And the most important thing is stay away from that bad air. If it means creating a clean air room in your house or finding a building that has good filtration, then that's what you need to do. Interestingly enough, of course, after everything that we dealt with in Sacramento, there is a new legislation, I believe it's AB 661, which is asking us to actually develop plans to be able to help schools and the homeless especially, to develop plans so that we can actually help them to get safe places and clean air places if we ever did have a situation like this, which is very likely, especially because everyone says with climate change, this is going to happen more and more frequently. So I don't have a very good answer for you except to say that, the most important thing is to stay out of the bad air.
Thank you.
Any other questions? Laura, go ahead.
Well, one comment on the mask. If you have a beard, it doesn't do you any good.
That's the other thing too. Yeah.
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 I have a quick question. You mentioned that the highest number of heat-related problems was downtown. Wondering if you could comment on why you think that was?
It could be due to several things. One is the population density. You have more people downtown. Two, you have more homeless people downtown, and those don't have appropriate shelter, so we have more of them being exposed and more vulnerable. And three, of course, being the urban area, it's probable that these were areas where they didn't have shading or enough shelter, so people were more exposed.
Also, you have the latent heat buildup with all the concrete and
Yes,
asphalt. And it doesn't cool off in the evening like it does down where I live.
that is correct. There's more concrete downtown, so that adds to it.
Okay, Josh, yes.
This is a bit of a tangent, but we're on the topic of air quality. Does the county look at all at air quality and health impacts next to high volume roadways? From not wildfire smoke, but vehicle emissions?
I don't think that we have looked at that, but the Air Quality District does.
Okay.
I could ask them specifically what information they have, and I can definitely get back to you on that.
Okay. I was just curious.
Yeah. We, as I mentioned, we're the way that we're collecting our information is mainly based on the reports that we're getting from places like emergency rooms, but the Air Quality District does the direct monitoring, and actually they're the ones who give us the data on the PM 2.5 and that kind of information, and the ozone, of course. And when there is an event, we work to get very closely with the Air Quality District in putting out information to the public.
Thank you.
Any further questions? Well, thank you. Please proceed.
Okay, so switching gears to Mercury in face cream. So there are certain skin lightening or acne creams that are being brought in, and in Sacramento and also in California, most of these are actually being brought in from Mexico. The creams are purchased usually through an informal network, and either they're purchased from Mexico and then brought in, or someone brings them in their luggage and then sells them at places like flea markets, or like I said, informal groups where they meet and exchange these creams. And usually they are used to remove freckles, blemishes, age spots, and also to treat acne. Some of the products, as you see in this picture of the case that we had recently in Sacramento, it's actually a product that is manufactured and then sold in a store, but someone was actually getting these products and adding mercury to it. So when you read the list of ingredients on the jar, you will not see mercury listed because the manufacturer does not use mercury, but they were sold as enhanced or more effective. So it does make people think that these are products that they can use. The state of California has been following up on these cases, and there've been several that have been reported, including not just actually adults, because the problem, of course, is when a person uses this cream and they're taking care of a baby, either breastfeeding or in the normal course of taking care of a child, children might also get this contamination, and there have been some cases of children and babies that have been exposed to this mercury. The California Department of Public Health, and this is the FDA, has found creams to contain very high levels of mercury, up to 210,000 parts per million, or 21%. It is illegal to sell skin cream products in the U.S. that have 1 part per million or more of mercury. So something like 210,000 is extremely high. The symptoms, unfortunately, for mercury poisoning are kind of vague, and sometimes they might start very slowly. So there are a lot of people who probably show up multiple times to their healthcare provider with these symptoms, and it might not be detected because maybe the healthcare provider doesn't think to test for it, because the test for mercury is not done on during regular visits. It has to be that the physician thinks about it and says, okay, this could be mercury poisoning, and then does the testing. So I'm not, of course, not going to read it to you, but you can see that there's a number of ways in which a person may present to a healthcare provider. So turning specifically to the case that we had in Sacramento, 47-year-old woman admitted to a hospital with numbness, disturbance of gait, slurred speech, and this continued to worsen over time, and over a period of a few weeks, she actually became unconscious. When they started questioning the family, they found out that this woman had been using a face cream, and she had been using these face creams for a long time. She was purchasing them from a person who was bringing them in from Jalisco in Mexico, and she had had no issues. She was using them to remove wrinkles. But this time around, she got this new product and she started not feeling well. Fortunately, the hospital thought of testing for mercury, and they found levels of 2,630 micrograms per liter. Normal levels should not be more than 5 micrograms per liter. So she had very high levels. What they found also is that when they did the testing of the cream as well as her blood and urine, she had a certain type of mercury called methyl mercury, which is a lot more toxic because it can easily cross the blood-brain barrier. And once it does that, the person has neurological symptoms. Because part of the reason they thought about this is that the woman was having such severe symptoms. And when the state was contacted, they said, well, they've seen cases of mercury poisoning before, but usually it's mercury salts, and the levels don't get that high and the symptoms don't get that bad. But this woman became unconscious. And so, of course, the state contacted us and said, okay, we need to put information out to the public. We need to tell them about what's going on, because these products are being sold, like I said, through informal networks. So we can't just go to a store and pull down all the products, because those are not the ones that, especially if the seal is not broken, those are not the ones that are contaminated. And it's also very difficult to find out who's bringing them in, because it's not just one person. And plus also, when in questioning the different people, they were not very forthcoming about the name of who they got it from, because they didn't want this person to get in trouble. So the ways that we have been dealing with this is by putting warnings out in the media, and you probably heard about it when we put it out. And we're also doing outreach, specific outreach to the communities and providing education. And part of what we're doing is actually going in to some of these flea markets and buying some of these products, and then being able to test them. And if they test positive, then coming back and providing education, because oftentimes even the people who are selling them at the flea market might not even know that there's this added ingredient. So the best way that we can work on this is to put the word out. And also we put word out, so if there are any people in the community who suspected that, you know, they've been using this product, they're feeling a little woozy or something like that, They go to their healthcare provider, get tested, and also bring the cream to us, and we can test it as well. So this is going to be a long-term project that we're working on in terms of providing the education, and we're working very closely with the State Department of Health, and then also working with community-based agencies that can provide education to these communities. So before I move on, any questions on this?
Any questions from the Commission? Paulina, thank you.
How many of the samples, or do you have any samples that did test positive for mercury?
So far, apart from the first woman who was tested, we've had at least 3 others. I haven't gotten an update from the state to find out where they're at right now, but the last time that they gave us an update, there were at least 3 samples that had tested positive.
Were those 3 samples, was the concentration also as high?
No.
Okay.
No.
Mark?
Is it illegal to bring this stuff in to California?
Well, it's illegal to add the mercury, that's one thing. And the problem, of course, is that the people who are bringing them in, some of them are actually homemade products, and then some of them, people do make products. We've actually, I'm sure all of us have gone to flea markets and seen products like soaps and different things that are made, and so you don't think about it, but I think the problem, of course, and the danger is when they're being marketed as better than the regular product, and they can get rid of all those spots and wrinkles or lighten your skin, then people should be aware. And of course, I also learned something actually from the state, because I was wondering, well, how does the mercury work? What happens is that when it gets into the skin, it actually replaces melanin. So then that's how the person becomes lighter. But of course, the value of melanin, it's also supposed to be able to protect you from the sun, the UV rays. So there's another danger there in that these folks are, maybe might get smoother, lighter skin right now, but they are exposing themselves to a lot of dangers, either from the mercury poisoning now or later on because of the exposure. They could very easily end up with cancers as well.
Any other questions from the Commissioner? Please proceed.
Okay, this is the last one. Respiratory illnesses and deaths related to vaping. I don't know if you can read that information, and I apologize. I think I will email the update to Jill so she can send it out to you. But this is the information. Every week, the state actually sends us an update on the number of cases that have been reported. So the total has been 133. And this was as of beginning of last week, which was when I was creating these slides. And now I'm having problems reading it. Most of them are actually male, and the age range is anywhere from 14 to 70, so a huge age range, but I think the majority of them are in the younger age group. And so far, as of this report, there were 3 deaths. But I'm sure probably now we're having more cases. At the national level, it was 1,500. We're almost at 1,500 reported cases. So this is not an issue only for California. It's actually a nationwide issue. And of course, the question has been, why all of a sudden are we seeing these cases? So in addition to getting the cases reported, the CDC has been doing additional interviewing. And they're also actually, when they're able to, they ask for the cartridges and have been testing the cartridges. Again, I apologize, this might not be very easy for you to see, but again, gives you some demographics. 76% white, 4% black, 1% Asian Pacific Islander, and then 14% other. And then more information at the bottom about the products that are being used. For the cases where they've been able to interview and find out what products were being used, 81% said that the products that they were using had THC. 38% said that the product had CBD, and 47% said that product had nicotine in it, and then 10% only nicotine. So this gives us a really mixed picture, because I'm sure you've heard reports about, oh, it's the THC, then no, it's another chemical that's being added to the solution. So we don't know for sure. And part of the problem, of course, is that it's not very well regulated. This is a new product that just started a few years ago and became quickly very popular. One, because it was being marketed as a product that you can use to get off nicotine. And then also, it's one of the things I found out is that, especially for the teenagers, is that if they use the vaping product, they didn't have that lingering smell that you usually have when you use cigarettes. So they were having a lot of kids going to the bathroom to do the vaping and then be able to get back in class, and the teacher wouldn't be able to tell. I've heard reports that some of the schools have had to close down their bathrooms because of the children going in there, or especially teenagers, and actually using these products in the bathrooms. And of course, our concern is if the kids don't have bathrooms, then that creates another problem for us, which we definitely do not want to have. Also, this shows you the reports that we're receiving. It seems as if the numbers are reducing, but just to let you know that there is usually a time lag, so we don't know for sure, but the numbers are actually reducing. We will know over time whether our message that is going out telling people that they should probably stay away from all vaping products, that it's actually happening. But again, this is how we track what's going on in the community. I wanted to show you this because it's really important for youth. When you look, the yellow section of the bar shows you flavored products. And the first bar that you see on the left-hand side shows you the vaping. So this is for youth, and it shows you for the different things like for cigars, cigarettes, cigarillos, and for e-cigarettes, how much what percentage the youth are using it. And one thing that stands out to all of us is that the yellow bar is so much larger than the blue bar, or the blue section of the bar, and that's because the flavors that are being marketed are targeting the youth. So for a while, we had been making a lot of progress in actually reducing the rate of smoking among all the different groups. But now, especially with the introduction of e-cigarettes and with the thought that e-cigarettes will keep children away from becoming addicted to smoking, now we're seeing that the children are now picking up e-cigarettes, and especially the flavored tobacco products. The reason that is important is that you probably may have seen that now a number of cities are actually putting ordinances in place banning the sale of flavored tobacco products. So it will target the vaping products, it will target the cigarettes, but especially the flavored tobacco products, because those, especially when you listen to some of the flavors, they have bubble gum, donut, and so on and so forth. You can tell that definitely what they're trying to do is make it more palatable to the youth. And so what we're trying to do with those ordinances is to actually do primary prevention, where we make it less palatable, or especially for the youth, because if we know that if we can prevent them or delay them even starting smoking, the greater the chance for us that they will never take up the habit. So places like Los Angeles recently passed this ban. Sacramento County is in the process of considering it. We're hoping that we'll be able to put an ordinance before the Board of Supervisors in November, but we're still working on it, so I can't give you a specific date, but as soon as we know for sure, I will definitely give that information to Jill. If you have any interest in providing support for this ordinance. I believe that is, yeah. So that's a lot of counties and cities are going towards banning flavored tobacco products. Of course, San Francisco said, well, that's not enough for us. They decided to ban all vaping products. And so we're waiting to see how that goes and then go from there. If we need to go back to the Board of Supervisors to look at our ordinance again, then we will do that. I think that's it.
Well, thank you very much. That was a very good report. Are there any questions from the commission? Tom?
This is October, late October, and you're talking about going to the board for what, the first reading of the ordinance next month?
Yes.
That pretty much means the way we meet and everything else, we probably have to make a suggestion on that tonight. I'm not sure if that's doable.
What's the schedule if they're reading it next month?
I'm not sure if we have a meeting before the Board of Supervisors would have this ordinance on their agenda in November. I don't know.
Well, I guess I don't understand the process for passing such a resolution.
Well, if we were to make a support or a recommendation on the flavored type of vaping products, and the Board of Supervisors is going to look at the ordinance the first half of November, we probably won't meet again until.
Yeah, but we haven't even seen an ordinance to comment on. So there's nothing we can do tonight regardless.
No, and I regret that because I think you would get our support.
Well, let's take a look into what the status is of the resolution and see if there's something that we can consider and look at the schedule for what the
it may just be the first reading, in which case we would have time.
Yeah.
Yeah.
Anything else you want to bring up, Tom?
No, that's about it.
Laura?
I have a quick question. I had thought there was some kind of an ordinance or law that was going to ban those shops within so many yards of the school. Is that not?
So the city of Sacramento did actually pass the ban on these products, and they also have, I believe, a 1,000-foot area that they, distance from a vaping shop and a school. I can provide the details of that ordinance to you. My apologies that I can't provide you the draft of the one that we're providing for the county because I guess it's it's still in the works. We're still working on it, but I can definitely get you the one for the city because that one was passed, and you can see what ours is. Probably the county one is probably going to be very similar to that.
I see, and that they're talking about banning all the flavors.
Yes, banning
in the county.
Banning the sale of all flavored tobacco products. So that will include cigarettes, it will include cigarillos, it will include the e-cigarettes as well.
So not age-related, just an all-out ban, right?
I'm sorry?
Not age-related, like not.
No, it's not age-related.
Okay,
yes.
All right. Okay, thank you.
Okay.
Mark?
I find it fascinating that these things initially were sold as a way to stop smoking, and yet what's happening is our kids are learning to smoke with these things.
Well, that's why a lot of parents and teachers are very upset because now they're seeing a reversal of trends where we were having a lot of success with children not picking up smoking, and then only to find out that some of these products have even higher levels of nicotine than the cigarettes. So,
is there any opportunity, do you think, to get problems with these things, these vapor problems, added to your report for your syndromatic report?
Actually, it is added. Yes, it is one of the syndromes that we're looking at.
Great. Thank you.
But to go along with that, I believe the chart showing the flavored tobaccos really, it's a marketing tool to sell them to kids. I mean, bottom line, that's the truth.
Yes, it's very clear and obvious.
Yeah, it is.
Yeah. So I have a few things that I need to email to Jill so that she can send out to you. One is the California facts and figures that shows you more clearly what the chart that I was showing you, and then also the state report that shows you the number of cases that have been reported with respiratory illness associated with vaping.
Very good. Any other questions from the commission? Dr. Kasiria, thank you very much for coming. We appreciate your effort to
Thank you for your time.
Thank you.
presentation. Our next agenda item is addressing zip cars and e-scooters, success data, and unexpected consequences. And making a presentation is Jennifer Donlin Wyatt, Department of Public Works in the City of Sacramento. Hi.
Hello. Good evening, Commissioners. My name is Jennifer Donlin Wyatt. I'm the Transportation Planning Manager for the City of Sacramento. And with me is Jennifer Venema, because we can never have too many Jennifers, who will also present a little bit of background on who we are. So we work for the Department of Public Works in the City of Sacramento. Our department is charged with maintaining our 3,000 lane miles of roadway in the city, keeping them up, our 88 miles of trails, and probably that's our biggest work that we do is maintaining what we have. We also have, we strive for traffic safety. So our Vision Zero program is one of our biggest programs that we do in the city that touches many aspects. Another piece that's probably important to you is seeing how we can convert single occupancy vehicle trips that are in ICE or internal combustion engines to other ways, supporting active transportation, car share, walking, biking, all those wonderful things. So I'm going to turn it over to Jennifer Venema, who's first going to talk about our car sharing program, and then we'll go over on our shared rideables, bikes and scooters.
Thank you, Jennifer. Hello, everyone. Jennifer Venema, as the first Jennifer described. We're really happy to be here with you tonight. So I'm going to click this, or try to click this. Maybe the arrow. Let's see. No, I might need someone to show me how to click this. All right, it's not, I got it. So in terms of the car share program, so in the Department of Public Works here at the City of Sacramento, we administer car share in city limits in a variety of ways. So what I'm speaking to tonight is only within the City of Sacramento. Car share is quite simply a new way for people to access shared vehicles. It's different than car rental through your traditional enterprise, pick-me-up type of car rental. It's one rate that you pay to use a vehicle for a limited time, which is all inclusive of insurance, fueling, etc. We have two types of it within the city, on-street car share versus off-street car share. So they operate very differently. If you want to be on the street in the right-of-way, that means that you need authorization from the city in terms of the types of parking privileges that you have access to. That's important because these companies want to be where there's lots of people, lots of density. You've probably seen the zip cars. There's numerous signs throughout downtown. So these are cars that are visible where people are. You can pick up a car where you are and end a trip in a variety of locations. So that's the first form, on-street car share, for which our department offers a permit and a regulatory system. The second type is off-street car share. So there's car share that happens on private property, where a property owner will enter into an agreement with a company or an organization, and that company is the one to run the car share vehicles and provide the service. Now, notably in the city's criteria for on-street car share, it's very clearly delineated that the service has to be operated in a way that there's no attendant at the site. So everything's used via basically a smartphone app. Whereas with other types of off-street car share, again, these don't need city permits, so they might operate in a variety of ways. We have 276 permitted vehicles to operate in the right-of-way as car share vehicles in Sacramento, and almost 80 car share vehicles off-street, which primarily operate in multifamily housing complexes. In terms of the on-street types of car share for which we administer the program, we offer essentially 3 different types of permit. Car share can operate in one of 2 ways. Essentially, think of it like the bikes. It can be a docked bike or it can be a dockless bike. So there can be a car share with its own exclusive parking space like Zipcar, or it can be a car share vehicle where you pick it up and you end it where you end your trip. So we price accordingly, and important in our pricing structure, we incentivize zero emission vehicles. So you can get a parking permit for half to a quarter of the cost of the standard rate for cleaner fuel technologies. And why we care about this, these are cars. Why do we want to promote cars? Well, studies show us that by putting these shared vehicles on the streets, each one of them tends to eliminate 7 to 13 personally owned vehicles. And for a small minority of participants in car share, they end up reducing vehicle trips overall because they end up paying for the shared trip for the shared vehicle when they need it and opting to use transit, bike, or walk in other scenarios. So Zipcar has been operating in the city the longest. They currently have 16 dedicated exclusive spaces in the right-of-way at 8 different spots throughout the central city. They're seeking permits for an additional 8 spaces, some of which involves a redistribution of a few existing spaces. There's over 11,000 trips on average that they reported being made per year. And what's really exciting is for people that participate, they survey them, and they learn that people that participate end up not buying a car, and they end up biking or using transit more than they use these shared vehicles. There's a special nuance to this program in partnership with the Air District, the city, and other agencies. There are dedicated vehicles at affordable housing throughout our communities at 7 sites, and this is our community car share. So also operated by Zipcar, but in this program, those vehicles are available completely subsidized, free of charge to the residents. Those cars are available up to 9 hours per week per resident, and it's been delivering real important quality of life benefits for people in our community. Gig Car Share is the newest permitted car share operator in the right-of-way. There are 260 all-electric Chevy Bolts throughout the city. You've probably seen these black cars with the conspicuous blue bike racks on top. Part of it is they really like to encourage the multimodal sort of lifestyle, and they're very much all about framing car share as an option that supports its car-light living to, again, use other trips where it makes sense. There's about 2,000 active members in the program, and this is the type of car share where you pick it up where you find it, use your app to unlock the car, and you end your trip where you need to. There's a 13 square mile home zone, which encompasses most of the central city, where you can find those cars. You can drive outside of the home zone. You just have to end your trip within the home zone. And that concludes it for my presentation. I'll give it back to Jennifer Donlin-Wyatt.
Great, thank you, Jennifer. So we're going to move over to shared rideables, is what we call our bike and scooter share that we have in the city. We began with our first launch in 2017, May of 2017, yeah, with a small launch of social bicycle bikes. There were the white bikes that were here. We grew to a full system of approximately 500 all-electric assist bikes through the SACOG-funded bike share program in the city. As we were going through this process, there was disruption in the shared rideable world. The innovators like to disrupt. And we had the introduction of dockless bikes and dockless scooters. So we were going through a process, which I'll highlight a little bit, to embrace new things as they come in, but set up a healthy regulatory framework to ensure public health through this process. So why do we like these devices? Because they have great potential to replace vehicle trips, so that we have more trips that are active or more trips that are not internal combustion engines. Provide that first and last mile trip to transit if needed, or just to make shorter trips. While the dockless revolution has arrived, there have also been a number of challenges that we've been working through this, and I'm sure that you're probably aware. It's complex. While biking is allowed on sidewalks throughout the city of Sacramento, including e-assist bikes, this is the discretion that the state has given local jurisdictions, that we regulate that, and our city council has said biking on sidewalks is A-OK. The state has said that scooting on sidewalks is not something that you can regulate at the local level, and the state says no scooting on sidewalks. So it's not intuitive to our population out there. We've been doing a lot of education, but we're working through that process. The other challenge is with the dockless revolution that these devices are left blocking sidewalks. And then teaching new folks who are new to traveling on smaller wheels that aren't a vehicle what their rights and responsibilities are, how to use our network. So what did we, there we go. Okay, so the process that we started was to revise our current iterative process of our regulatory framework. I think I will be going to our city council on an annual basis, it feels, to update our rules. We did a lot of outreach. I think it was really important that we worked with our communities to identify the needs, potential challenges. We took it to our Active Transportation Commission. We took it to our Disabilities Advisory Commission. We went to Law and Legislation, which is a subcommittee of council. They asked us to go back to the Active Transportation Commission. We did. Back to Law and Leg, and then to council in April for adoption of our current regulatory framework. One of the things we also did was work closely with other cities across the nation, and particularly in California, who already had these dockless devices, to learn what was happening in their cities, what was working, what wasn't working. If they could go back and do things differently, what would they do? Such as you can see here in the photos, this is the Starbucks on 9th Street right by City Hall across from Cesar Chavez Park. We had a problem with people locking up to the railings at the Starbucks. That's an ADA railing. We really don't want people obstructing that. So what we did was we just put some bike racks out there, and then by providing the infrastructure, people did the right thing. And these bike racks outside of Starbucks are well used. The railing has, to my knowledge, not been blocked since we put in the bike racks. So these are the things that I went through to strove to address with our process. We wanted to avoid blocked sidewalks. We wanted to avoid improper parking, sidewalk riding. We wanted to make sure that our lower income communities had access to these, because again, when you have transit or transportation that's provided by private companies, you don't get the outcomes that you want or equitable outcomes that you want. So we want to ensure equity. So council asked us to ensure that 20% of the devices go to our low income communities every morning. And we want to ensure full cost recovery. I have a mighty team of 5, and we spend way too much time on this. We get an incredible amount of issues, of complaints, how to work through the regulatory process. Are the permit holders upholding their obligations under the permits? So we develop permit fees to reflect the cost to the city from them operating in the city. Operators wanted lower fees, not surprising, and they wanted a per trip fee, because it made sense to them that only if they were making money did they want to pay money. So the more trips they have, the more it costs them, but also the more money they make, so it was a balance. From our local communities, we had concerns about accessibility, that we had parking for the bikes or scooters, that the parking was off the sidewalk to encourage scooting and biking on street rather than having parking on sidewalks that would encourage use on sidewalks. Ensuring the sidewalks are kept clear, enforcement, and then equity was a big thing for our communities. So we've had, this new permit structure has been in place since May, because it's a 30-day period. We've been doing a lot of outreach. We have been going out in the field with police officers, so my team with Public Works, and then working with PD with our uniformed officers. Have been going out and targeting users of shared bikes and scooters and little flyers and educating them. people in uniform command a lot more respect than me trying to stop somebody on the sidewalk. So we are no longer trying to stop folks, and we're letting our uniformed police department handle that, although we will provide them support that they need. We also had, we teach a free urban biking and scooting class every month. We work with and encourage our partners in our shared rideable community to send their folks to us. We are now taking our little class on the road, taking them to libraries across the city to team up with our library system. We did 2 blogs and videos, and then education through social media. So the one on the top is, I think, quite a funny video that our public information office put out. It's of me, and they included all the outtakes as well. It was kind of a humorous video to get people's attention and to get people who are using the shared bikes and scooters to follow the rules. And then the one below is a tweet from our police captain from downtown, Captain Leong, who has been a great partner in this. He has a great sense of humor, and he on his own was tweeting out stuff as well because he has a following to get the message out. So we've been doing a lot of outreach about rights and responsibilities. I'm sure you want to know, well, how many do we have in the city of Sacramento? We have currently permitted 1920 devices, that's bikes and scooters. We don't differentiate in our code, although we have approximately 700 bikes. The remaining are scooters. And that's as of when I made this presentation on Friday. We are about to, the way the permit structure works is each operator is allowed to bring in another 250 devices every 3 months. Lyme has hit that threshold next week, so we'll expect another 250 devices next week. But they're getting used. So if we want to talk about, well, there are definitely challenges, there's definitely benefits. Since June through October 6th, we've had over 500,000 trips on these devices within the city of Sacramento. 27% of them are scooter trips, which are about 1 mile in length. The remainder are bike trips, which approximate an average of about 2 miles in trip length. So a great opportunity to, again, replace vehicle trips to provide the first and last mile opportunity to transit, to support transit. Regional Transit is a great partner and has been a partner through this. And so we think while we're working out the kinks, we're going to start big time enforcement, I'm hoping, in November to start issuing citations for scooting on sidewalks and parking improperly, and working with our private business partners, the companies, on ensuring the word gets out to their members. I think the overall, once we get past these hiccups, we're going to really see a great benefit in the city for congestion reduction, reduction of GHG, and reduction of vehicle miles traveled. We are keeping track of the complaints. We ask that people actually report through 311. We know that many are not coming to us. We've had approximately 1,500 complaints between June of 2018 and August of 2019. 63% of those were folks calling in that a device was not parked at a bike rack. 28% of those, of the reports were that we had an obstructed sidewalk, and that's a serious issue for me. We want to make sure that we have an accessible path of travel for people with disabilities. So this is one of the reasons why we're going to be moving forward with enforcement pretty soon. And then some other specified problems. We also see that tracking the data across the time that we've had, that we saw a big jump in June, and that coincides with when Jump/Uber was able to up the number of devices that they had. So have more devices, we have more complaints. And then July is when we introduced Lime scooters. So again, we'll see a little bit of an increase then, but it is dropping down a little bit. And as we get more data from our 311 department, we'll continually update this. So that is it. Both Jennifer and I are happy to take any questions that you might have.
Great, thank you very much. I've got a couple questions, and I'm sure maybe the commissioners do too. I agree with what you're saying. I think, but this is just a personal observation, that I think this is just the beginning of e-bikes within the community. I think it's going to explode over the next several years as more private owners begin to acquire them too. So you can not only have the shared rideables, but you also have the private bikes that are also going to be contributing to the same issues. And I think from a personal perspective, I think that there is a disregard for obeying the rules of the road. And I'm wondering, is the city liable in the case of any accidents or other incidences involving a rideable bike that's either moving or stationary?
I am no attorney, but we do have clauses that we require insurance that the city is indemnified. And again, this is not a city program. This is a business permit. So just like any Starbucks that came in and offered coffee, if an incident happened within Starbucks while they have a permit to operate a business in the city, it is not a city program.
But you are enforcing the rules of where you park and where you ride in the city streets.
Just like any driver.
Correct.
Yes.
Okay. In regards to parking these things on sidewalks or blocking driveways, isn't it pretty easy to find out who the prior user was from the operators of these machines and find out who's responsible for parking it there?
Well, the way that we have our code written is we don't, just like a enterprise or budget car rental, we cite the company, and then the company can then choose to pass over the citation to the user. We don't want to take on the administrative burden of finding out who that person was, nor does the companies have great privacy concerns, want to share that data or information with us. So the citations for illegally parked devices will go to the company, just like we do for any car rental issue, like you park your budget rental car in front of a fire hydrant. That goes to budget. Budget will then cite me for parking in front of a fire hydrant. And so that's the process that we'll use. We've actually empowered our parking enforcement officers, because this is a parked device, it's just a scooter or bike. They're the ones that are enforcing this regulatory fashion. It's great because they're already out in the fields, they're boots on the ground. So when they are doing their patrols and they're collecting information, if they see a scooter or a bike blocking a sidewalk or a driveway, they can issue that citation. And the way that it works is that they'll issue that citation. It's fancy electronic software that also will go to 311 immediately, so that 311 will contact the company, and that company then is notified they have 2 hours to move that device.
Okay. What about speed limits of these bikes? Do you enforce them through our regular traffic code, or I know some bikes can go 25 miles an hour.
So,
and on a sidewalk, that could be a hazard to pedestrians and everybody else.
For our shared rideable regulations, electric assist bicycles are limited to 15 miles an hour, and motorized scooters, per state law, are capped at 15 miles an hour as well.
And so, still, a moving vehicle at 15 miles an hour could be a hazard if there's a pedestrian there.
That is probably why the folks in the state said scooters have to not be on the sidewalk. The city council has not yet taken up the topic of electric assist bikes on sidewalks.
Okay. All right. Any other questions from the commissioners? Josh.
Well, thanks for a really great presentation. That was a lot of really concise, helpful info. I'm curious because there was a little bit of data with regard to car share about how many personally owned vehicles a single car share car will replace on the road. And I'm curious as to whether there's any calculation that you could arrive at in the case of the bike and scooter share. Because we know how many trips and we know the approximate length of each trip. Is there, I guess without fudging the numbers too much, is there a way to estimate that sort of thing?
Not at this point. So this is a new way of mobility. What we do hope to do later, probably in the spring, is do a survey and ask the users. So we'll have our operators send it out to their members who are in Sacramento and ask them an estimate of the trips that you've taken using Jump, Lime, Bird, and the others, how many of them replace a vehicle trip? And to get an idea. With a trip that's a mile, it may not be replacing a vehicle trip, but greater than a mile, 2 miles, it might. But again, we'll look at the survey data, and I think we'll use that and then base that on that we have over 500,000 trips. That's just the last couple of months. I mean, I really do think that we're gonna see great progress towards replacing vehicle trips.
And I wonder how many people who live in the central city might just forego owning a car altogether if they're making things work through the scooter or bike.
I think that would meet one of the goals of what we're doing.
Thank you.
You're welcome.
A couple of questions. One of your slides about the zip car talked about 11,000 trips per year using these vehicles. What's the average number of trips an individual does with his own vehicle?
That's a good question. I'm Not sure of the answer to that question.
So it's many.
Yeah, but you figure 11,000 trips for the 16 parking spaces. So you figure, look at that in terms of the number of trips per vehicle. It's much more than someone's car that sits parked most of the day.
Yeah. Have you guys calculated any greenhouse gas reductions due to this program?
Yeah, Zipcar has done some estimated calculations using their own assumptions. We will be calculating the credits from all of our shared mobility programs and looking at trying to get at what those reductions are through the city's climate action plan update, which is now in process.
Is there any chance for you to get cap and trade money to support the program more?
It's a potential. I believe cap and trade might be one of the funding sources that paid for the Our Community Car Share program, which is funded by the Air Resources Board.
Thank you.
Tom, go ahead.
Make sure the mic's on. I actually start with 19 questions, so you did a pretty good presentation. You answered a lot of them. But I still have about 4 questions. Let's get to the low-hanging fruit. There's a 15-mile-an-hour speed limit. What is the speed limit of the streets that they're allowed to use these on? Some jurisdictions have limited it to 35-mile-an-hour speeds, city streets. So is this part of that ordinance, or can they go on 45-mile-an-hour streets?
That is a great question. So for the bicycles, there is no restriction on where they can and cannot be used. For the motorized scooters, state law says that they can only be used on streets of 30 miles an hour or less, unless they're in a bike lane.
Okay.
So there are a couple of streets on the grid that are likely not available to scooter riders, but we haven't done the detailed analysis yet.
Okay, but as the streets get upgraded, I imagine that'll change.
Yes.
Now on to safety. I have 2 safety questions. Are these scooters inspected in any way, or can you just go rent one and the handlebars fall off?
Our city ordinance requires that they have regular maintenance and a detailed maintenance review every 6 weeks.
Okay. And since we have the county public health officer here, there's been studies that emergency room visits go up when these scooters are introduced, with broken bones and not wearing helmets and head injuries. So as part of your metric tracking, it kind of leads into that, So have you seen that, or is it too early yet?
Well, the data that the city of Sacramento uses is our police crash reporting.
Okay.
There is actually no way on any of the state forms that our police departments use to collect whether or not it was a shared scooter or bicycle. We are working with our police department to have a way to track that, but we don't currently at this time.
But I hear that the county health official has an in with the hospitals that could track that for you.
There is hospital data that we could look at and collect. That is correct.
And my last question goes back to zip cars again. It's just a fun question. There have been futuristic projections that eventually there will be a parking garage like we have right here filled with electric cars. And when you want a car, you just say, I want a car, and autonomously it'll pick you up and drive you. That's out there in the future, but they're saying 5 years. I
believe, well, if that's your question, so I know at the city, we see mixed research in terms of the timeline and various status of business development. What we know from the staff perspective is if and when, well, it's here, but when autonomous vehicles become more widespread, it's critical that they're shared and that they're electric, because it's still a car taking up space on roadways, whether or not there's a person in it.
So with the introduction of these zip cars, that kind of starts building the foundation for that.
For a shared mobility system, yeah.
Okay, so 19 questions, got it down to 5. So good presentation. Thanks.
Any other questions from the commissioner? Mark?
Great presentation. Just a quick question on for the bikes and the scooters. You mentioned for the equity that was it 20%?
Correct, yes.
And how is that determined, or is it like
We looked at SACOG's disadvantaged community data. We applied that with the exception of the central city. We removed the central city from those applicable locations. We knew that they all want to operate in the central city. So we were just using the SACOG data to have that 20% outside of there. And then they determine where they would like to deploy their 20%. We don't tell them. So Jump Uber is looking at, they're deploying to El Paso Boulevard up north of the river. Lime is looking at Oak Park. So where they decide what they think is going to be the most benefit to them, and then we let them operate. We do ensure on a weekly basis that they do deploy 20% to the disadvantaged communities.
and are the fares reduced too, or is it?
Yes, we do require that they offer a reduced fare program for their low-income members. We don't specify what that reduced fare program is, and each operator has a different one. But we do require that, and they do have that. And then we request, but we don't mandate that they have a cash-based option. So if somebody doesn't have a credit card, that they have another way of becoming a member.
Is there a way to reserve it without a smartphone?
Not to reserve, but to access it, and they give you an RFID card, and that way that you have access to the devices.
Thank you.
You're welcome.
Any other questions? Thank you very much, Jennifer and
You're
Jennifer. Appreciate your presentation. Thanks for taking the time to come to see us tonight.
Of course. Thank you.
Our next agenda item is the approval of the September 2019 meeting minutes. In your package, you have a copy of the meeting minutes. Are there any corrections or edits that anybody would like to bring up at this time? Mark?
Maybe more a question than an edit. In here, we reference that there's roughly 25,000 students at Sac State. I thought it was closer to 35,000, but I could be wrong. 30 anyway. If we could maybe just check on that. And
I'll check if she was referring to undergrad plus grad, and I'll get that
that
total.
would make a difference.
Yeah.
Thank you.
Any other comments or edits? If I'm not hearing none, I would assume that these are meeting minutes are approved. The next item is our director's report from Marie Wooden, Director of Environmental Management Department.
In anticipation of Lead Prevention Week, which starts October 20th, the Environmental Management Department will be providing lawn signs and pamphlets to heighten the awareness of lead poisoning in children. The lawn signs will be placed in front of participating child care centers that are part of the Head Start program. The lawn signs have signage on it that encourage the parents or caregivers of the child to ask their physician for a blood lead test. The brochures and pamphlets address repainting your home, an older home before 1978, and how to minimize any lead dust if you're remodeling, how to hire a contractor. And those brochures are being given out at participating hardware stores like Lowe's, Home Depot, etc. So that's what Environmental Management Department is doing to help, in conjunction with Public Health. Dr. Cassiere left, to bring awareness of preventing lead poisoning in children.
Okay.
Any questions?
I guess a question, maybe just a comment. I've been thinking for the longest time that this lead issue is behind us. Obviously, from what you're doing, it is not behind us, and we still have some real reason of concern. Is that correct?
Correct. So we do have a childhood lead program that we administer for Sacramento County. We have a grant that we get through the State Department of Health Services. It's about $200,000. And we work with Public Health, Department of Health Services of the county to investigate children that have been identified by their physician to have blood lead levels that exceed the norm. So there's different tiers that they can fall into, but yes. Any other questions?
I guess just to follow up on that, your comments and mine. So basically that says to all those folks listening to us, if you have any questions about lead, get a hold of EMD, right?
Yeah, or they can ask their physician, that's if they
Ask
have
the
small
physician, yeah.
children, and make sure that your child has been tested for lead.
In other words, if you have any questions, take action.
Correct. They can always call us, call Public Health too with the county.
Are the primary paths of exposure still things like lead paint, or is there other sources that?
Well, like Dr. Kasiri said, now Pond's cream that's been adulterated coming into California.
But that's not a
They-
child exposure.
Nursing
Yes.
from the mom possibly, but also what we find in our investigation is through cosmetics, Middle Eastern cosmetics and spices that are imported have high lead levels. Years ago it was the Mexican candy. They haven't had any of those reported cases this year, but still the pottery from different countries, and now spices and cosmetics.
Interesting. Okay. Because that's the end of your report?
That's the end of our report.
Okay, thank you very much. Commissioner comments, couple things, then I'll open it up to the rest of the commissioners. First of all, we've asked that the topics committee, folks who are volunteered to identify topics for our 2020 calendar year, set up a meeting and agree on the type of topics that you want to have before our next meeting in November 18th. So I'm requesting that we move forward. I think Jill sent out one email. Paulina, if you're interested in joining that committee, you're welcome to join. We've taken volunteers, and we're always accepting more interest if you have that interest. So I'd like everybody to move forward on that.
Excuse me, I think we mentioned a phone call instead of a meeting?
Yes.
Right, okay,
But it will be a meeting nonetheless.
got it.
Second thing is, next meeting is our November meeting, which is our last meeting of the year. And traditionally, we have our re-election of the chair taking place at that. So please keep that in mind and have any thoughts on that ready to go when we meet next month. Any other commission comments?
I would like to, if we have a possibility to support the vaping thing, even if we all agree the vaping ordinance, if we had to do it all via email back and forth to support that, if we can.
I think we should consider it and take a look and see what's
Yeah.
being proposed and see if there's an agreement or something that we
Yeah.
can all recommend. I don't think I want to do that in advance of seeing the resolution.
Yeah, but I guess what I'm saying is I would be willing to deal with it even via email review.
Oh, well, if we take an action, we
Needed
have to
to.
do it at a formal meeting.
Oh, I see.
Yeah.
Yeah,
I see.
that's why
I see.
I asked if it was going to be, the first reading was next month, because that gives you, 45 days? And we'll have our meeting next month. So if we can get the ordinance early enough to review, even if it's in draft form, prior to the first reading even.
Well, I think Jill will see if she can get a copy of the resolution. We can always distribute it among the commissioners and then be prepared to consider it at our next
But it
meeting.
has to be at a meeting. Okay, all right, okay.
Richard, a comment on that too. I was thinking the same thing you guys were thinking. If there was this is a really important topic, I think. I mean, it's critically important for our kids. But if there was a need for us to make any kind of comment, maybe we can figure out a way to make sort of a preliminary, informal sort of a comment if timing of the board meeting coincides poorly
The
with
commissioners
the
can
timing
feel
of ours.
free to submit personal comments to the board. That's the one option if you don't want to wait for the commission to take an action. But I think we are hamstrung to taking an action on an agenda item. So we can't do that without a meeting.
Correct.
Okay. Any other comments, please? Well, with that, then, our meeting is now adjourned, and who's speaking?
Just a quick mention. You mentioned the topics. So we're also the wards committee is going to be meeting too.
Okay.
Yeah, the wards committee. We have a scheduled call in November. Yeah, we're working towards a date. I think we're still working on a date. Yeah.
Okay, so let's put that on the calendar too, that you guys will, could you report back to us by the next meeting? And see how things are going, at least the status report? Okay, very good. So no more comments. Then we are adjourned till November 18th.